How we doing, everybody? It's Coach Alex from Maximize Potential coming at y'all with another great Mobility Monday. Today I'll be talking about one of the most debilitating, misunderstood overuse injuries in the US. But before we get into that, if you haven't noticed, our cold weather gear is finally here. We've got sweaters, we've got sweatpants, we've got beanies, and we've got a good assortment of hoodies. We've still got a good handful of deals going on right now, so make sure to grab some stuff while the deals are still on. I'm gonna go ahead and leave a link down in the comments below. Today, we're assessing runner's knee. So let's go ahead and jump right into it. Runner's knee, or chondromalacia, is a very common injury usually caused by overuse, with over 200,000 new diagnoses each year just in the US. Runner's knee may develop when the cartilage or surrounding knee structures are overused or injured. The most common symptoms is going to be knee pain that worsens when walking up or down stairs, kneeling, or squatting, or sitting cross-legged. But why is it that this happens? Well, your kneecap or your patella travels within a small notch in your femur called the patellar groove. As your knee bends and straightens, the tissues around the joint are going to keep that patella traveling in a stable position. The two main muscles that we'll be looking at is going to be the VMO, or the vastus medialis oblique, and the vastus lateralis. These are just fancy words meaning the outside and the inside of the quad. Now, if that vastus lateralis, or that lateral leg muscle, becomes stiff, they can pull excessively on the kneecap. When it pulls hard on that kneecap, it's going to end up tilting it to the side, causing it to track laterally in that groove. You can think of this like a train being pulled off of a track. If this isn't treated or isn't treated correctly, the movement is going to cause that kneecap to rub unevenly against the femur. This is eventually going to lead to the breakdown of the cartilage on the underside of that kneecap. It is going to be common for some of us to see small amounts of swelling in that knee for those of us who have experienced this. This is going to be because of repetitive microtraumas. Science has shown that swelling at the knee joint can cause that VMO, or that medial quad muscle, to shut down and stop firing correctly. This means that reducing swelling is crucial to restoring normal function of the quad muscle. We can do this with compression, elevation, or anti-inflammatories. How exactly are we going to treat this? Well, let's head out to the gym and I'll show us exactly what we need to be getting into. Alrighty, y'all. So, as I mentioned, priority number one is going to be to control the swelling. Once we control the swelling, we can go ahead and move on to the next step. And that's going to be to control the tightness in the lateral muscles of that quad. As I mentioned, whenever those lateral muscles in the quad get tight, they're going to pull on that patella and take it off track. So, the way that we're going to help loosen these muscles is going to be a simple quad roll. I really like using a hand roller because I can easily control how much pressure I put into these muscles, and helps me get into a couple of different angles that we're going to need to be getting into. So that being said, we're going to go ahead and start by rolling out the vastus lateralis. If you can't tell by the name, this is going to be the lateral muscle on the quad. The way I like to start is extending out that leg. That's going to help relax and kind of contract or shorten the muscles in that quad. Now I'm going to take my roller and go to the lateral side of that quad and put a little bit of pressure in there. Now, this is going to be a myofascial technique, so we want to scan the area. We're looking for a couple of different places that may be a little bit uncomfortable. Now, when we do, we're going to sit on it, and we're going to do a couple of small tilts with this hand roller. We should feel it dissipate in about 20 to 30 seconds. Now, I want us to spend about a minute and a half, maybe 2 minutes or so, digging around, finding a couple of different spots. Believe me, you should feel a few. Great, now that we've loosened up that lateral muscle, we can move on to the next area. This is going to be the IT band. Now, the IT band, or the iliotibial band, is actually one of the biggest, thickest tendons that we have in our entire bodies. Now, it attaches to the TFL at the top of the hip and runs all the way down the side of the leg. As I mentioned, the tendon is pretty thick, meaning that we can't really find a lot of benefit rolling directly on top of it, but we can find benefit by breaking up the tissues around it. So, with the IT band, I want to focus on just above and just below it. So we're going to go ahead and take that hand roller and go just above it. This is going to be just offset from that lateral vastus lateralis up there, So again, rolling all the way down, we should find a couple of spots. Same exact thing, seek and destroy. Once you find a spot, put a little bit of extra pressure, maybe 20 to 30 seconds. Now, with the IT band, I want to be here for about 2 minutes in total. That being said, I want us to focus 1 minute on the top, and then 1 minute on the bottom. So swapping over to the bottom, depending on your physiology and what you use the most, we may find some pressure or a couple of spots in one or both of these places. So dig around, search around. Once you find a spot, sit on it 20 to 30 seconds. So now we're nice and loose. Normally, we would get into a stretch after we get into a roll, but because this injury usually occurs because of overflexion or overuse of the knee, stretching and or flexion of the knee is actually going to be painful and possibly damaging to the knee. So we're going to go ahead and move on to a little bit of strengthening. As I mentioned earlier, if we have tightness or swelling around this area, the VMO tends to shut off. So for a long time, we thought banded VMOs were the way to treat this, because we thought, well, why not try and isolate that VMO? But we found out that there's no actual way to isolate that VMO. If we are going to be contracting the VMO, it means that we're going to be contracting the entirety of the quad. So how is it that we can strengthen the VMO and the structures around it without pain? Well, it's all going to come down to mechanics. See, chondromalacia is very common with individuals whose squat pattern makes them push the weight forward into their knees rather than backwards into their hips. So the way that we're going to start with this is going to be getting into a little bit of a touchdown squat. So we're going to start with a small height, about 2, maybe 4 inches. The affected side is going to go ahead and step up on the plate. Now I want to start with a simple hinge before we get into any type of squat. That hinge motion is going to originate at the hips. So with the affected leg on that plate, we're going to sit the hips straight back and allow that heel to touch the ground lightly. We can go through this for about 3 sets of 10 reps until we feel comfortable at a specific height. After which we can start adding more and higher, meaning that we have to get into deeper range of motions at the hips and knees the more and more comfortable that we get. As I mentioned, this primarily comes down to mechanics. Individuals who place the weight forward in their knees are going to experience much more pain versus individuals who set it back into the hips. When the hips bend, the knees are going to bend. Very rarely in a squat are we actually going to actively be bending the knees. It is an active bend and hinge at the hips that makes our knees bend. This is the proper mechanic of a squat. This will take away tension and pressure away from the knee and allow us to properly distribute the weight across the entirety of that kinetic chain. So make sure during a squat that knee does not start bending until the hips start moving back. The longer it takes for our knee to start moving forward, the more efficient that these squats are going to be. But anyway, y'all, that's about all I got for us today. I hope we learned something new. If we do suffer from runner's knee, chondromalacia, go ahead and try some of these things out at home and let me know how it works down in the comments below. Like I mentioned earlier, our cold weather gear is here. We've still got those deals going on, so make sure to head over to the store and grab some stuff while those deals are still hot. If you have any further questions on knee pain or want further intervention, go ahead and book a mobility session with me with the link down below. Remember, y'all, this is always a conversation, so don't forget to leave a like, comment down below with anything that you learned, questions that you may have, or suggestions for future content that you want to see. But other than that, I'm Coach Alex. Y'all be good, drink some water, and I will see y'all in the next one.